All right, we're going to go ahead and get started. It's 6 o'clock right on the dot. I hope everyone is doing well this after, or I guess evening now. With that being said, thank you all for taking the time and taking the hour in this next evening here to kind of talk about what we can offer you here at Montana State when it comes to your holistic wellness, your student wellness at MSU. With that being said, we're going to go ahead and get started. But first, we have a couple of slides here that are kind of going over the technical help in case you might not be able to hear me as we're presenting or Betsy as she's presenting. So you can go ahead and feel free to log into any of these numbers and utilize our access code. The other thing that we also have kind of new with our webinars is we have a platform that's called Slido. So as we continue on, this is the best way to communicate any questions that you may have and ensure that you get them answered. We have our team of other admissions counselors here as well to help in answering those questions as we go throughout the presentation. So a good way to kind of get there is at the very bottom. If you're on a computer or phone, you might have a little gadget there that's called the apps icon. So if you click on that and then you open it up, there's going to be a green S. And if you click on there, that will let you access the Slido app. And that's where we're going to be able to have any Q&As, polls, different things like that that might occur throughout the presentation, where we can, again, make sure that you get those questions answered. With that being said, we're going to actually kind of go ahead and get started with a test trial with our Slido app. So we're going to throw in the question, where are you from? If you guys want to go ahead and answer throughout where you're joining us from this evening, that would be super awesome. And kind of checking out where you guys are all coming from. With that being said, we have the wonderful Betsy Asserson here to help talk about what our student wellness is like here at Montana State University. So with that, I will pass it on over to you, Betsy.
Great. Thanks so much, Charlie. Welcome, everyone. Nice to meet you all, I guess, online for this webinar tonight. And I'm really excited to be here with you and talk about all things student wellness here at Montana State University. We're going to talk a lot about some of the exciting things that we're doing, as well as some of our amazing facilities and some of just the great work that we're doing here at MSU. And as Charlie said, please feel free to put the questions in, and I'll be sure to get to as many of those as I can at the end tonight, and happy to engage with you that way. And then I'll have my contact information at the end, and I of course welcome any of you to reach out and talk with me about any individual questions that you might have or anything else that I might be able to answer for you today. And then just also want to give a shout out to the admissions crew here, Charlie and all the others at admissions who do such a great job helping to get the word out to all of you about all the great things happening at MSU, so you can make an informed choice about kind of what your needs are and what you're interested in for this next phase. So excited to be here and chat with you. I'm the Associate Vice President for Student Wellness here at MSU, and I thought I would start by just giving you a little bit of my background so you know who you're talking to and what my path was to MSU. I actually did my undergraduate degree at Concordia College in Moorhead, Minnesota, and our mascot was a cobber. So let me just say I've moved up in the world on the mascot front, that now I can say go Cats go. But loved my undergraduate experience there and went to the University of Pittsburgh for my doctorate in counseling psychology. I knew pretty early on that I wanted to be a psychologist, and my career path to that was through Pittsburgh, and learned a lot about mental health and community mental health. But my first practicum experience was at college, and fell in love with working with college students and their mental health needs. And that really influenced my career path for what I might want to do with that degree in counseling psychology. At the end of that graduate program, we get matched to internship sites. And I thought, wow, it'd be super cool to go to Montana State for a year for my internship. And had visited Bozeman and had an aunt that lived here. And so I was excited to come out here, experience the mountains for a year, do something really different. And that was in 2001. and I haven't left. So just fell in love with the work. But really for me, it was the great ways that MSU really focuses on students. In some of my past trainings and working at other institutions and other places, it really, for me, the focus here on the student and student well-being was apparent to me even back then when I first matched here. And that really influenced my trajectory, I think, to continue working in college mental health. So I really focused on that and worked at the Counseling Center for a number of years, including being the director for about 7 years. And then this last spring had the opportunity to transition into this new role as the Associate Vice President of Student Wellness. That for me was a really intentional shift. I'm almost done talking about myself, but that I think what's important for me in sharing that is really seeing the importance of taking a more holistic approach to health and well-being. And I felt like at this point in my career, at least, it was a really nice opportunity to think more broadly about how do we support students. There will always be the need for clinical care and services, and I feel passionately about that, and we're going to talk about that tonight. But it was also an opportunity to think more broadly. How do we get students engaging in all the different aspects of their health and well-being? And that's what we're trying to do here in Student Wellness. So the two pictures on this slide within the Wellness Center, one is the climbing wall, and that's my middle son, James, up on the wall. And the other one are my 3 kids in the pool this last weekend at Family Day in the Student Wellness Center. So we really take a community approach to how we address health and well-being throughout our whole campus, and the importance of creating that environment to help our students grow, thrive, and ultimately pursue their dreams and what that might look like for them. So enough about me. That was a lot of talking about me. So we're going to talk tonight most generally, at least initially, about college student health and well-being in general. What are some of the needs that we're seeing and some common concerns that we see in the college population? I'm going to talk to you quite a bit about all of the great services that we offer in the Student Wellness Center and that integrated approach to health and well-being that we are engaging in. And then certainly we'll leave some time at the end for your questions. Okay, so how did we get here? You know, as I said, I've been here for quite some time, and the picture over on the left is the Swingle Health Center, and that's where my career started here at MSU, and that's where all of our health and counseling services were provided. And in 2017, we intentionally integrated those services. That was the first step for us along the path of taking a more holistic approach to health and well-being in college students. So we merged those 2 units, health and counseling, to where we could provide more of an integrative approach to care for our students. And then in 2019, we had in our recreation center, we had some snow load on some roofs, and unfortunately those roofs collapsed. No one was injured in that event, but it really prompted the discussion of how do we want to take this opportunity where we have some facility needs and think more broadly about supporting our students. And so a group came together led by our president at the time and really talked about how can we bring all of the important health and well-being resources together under one roof. And our students really became the driver of that initiative. So in 2020, our students voted to build a new student wellness center facility. And over on the right, that image that you're seeing there is the grand opening of that center in 2024. So that became really the opportunity for us to integrate student health, counseling and psychological services, basic needs, health promotion, and campus recreation services. And that really led us to this wonderful opportunity within our new building that you'll see some images of throughout to help us integrate all of those services. The new Student Wellness Center is a 165,000 square foot spectacular facility. And while the building is amazing, what's more amazing, in my opinion, is the work being done inside of that building, where all of the people are committed to supporting student health and well-being in a broad way. So backing up a little bit and talking about like what are some of those health and well-being needs that we know exist within the college population. I love this picture that every year our entering student body goes over to the field and they make an M in their matching shirts. And I use this image a lot with my team to just ground us in the reason we're here are the students. And so our students, again, are the center of everything we do. And we know our students, as they're entering college, are dealing with many common concerns wherever they might be going. It's definitely a time of change. It's definitely a time of developmental growth. And there are challenges and concerns that come with that. So I like to talk about that on the front end to help students start to think about like, what will be different when I go to college? What are some of the challenges that might be there? And then thinking about what are some of the resources and supports available to me as a student to support me in those. So common concerns we think about for entering college students are transition and change. I always talk to students about how many of you have shared a bedroom, how many of you have been responsible for managing your own healthcare, in charge of your own schedule. All of those are really different developmental challenges. We also know at this traditional age range and entering college that we can start to see mental health challenges. And we also know many more students are coming to college with mental health challenges that have been treated and addressed earlier. To me, that's a good thing, right? That students are getting the help that they need, that they're having that early support. But we know transition and this time of entering college can be the time where mental health challenges start to emerge. The access to substances on a college campus is certainly different, and that can be a concern and a challenge for entering students. Relationships change dramatically, and people are learning how do they manage when they're sick and what do they do in those situations. All of those kind of common transition and challenging experiences for students really load on the opportunities that we have within student wellness to support students. So we're fully engaged in helping them build those long-term healthy habits, enhancing their coping skills, and creating a space for them to figure out who they are. That's a critical part of that transition to college, is to look at different aspects of their identities, trying on different things, trying out new relationships, trying new experiences, and trying new ways of taking care of themselves. So I think those opportunities are all ways that we support student health and well-being within student wellness. So this is an image of the outside of our building. If you haven't had a chance to visit campus yet, just trying to give you a little bit of a flavor of that. But within our area, all of us are housed within this facility, including the three departments that I mentioned. And our vision in student wellness really is to have a thriving campus culture of health and well-being. We were really intentional about our work in setting that vision this past summer as a team, to think about it's not only the students, but it really is creating a culture for our whole campus, because our students are interacting with faculty, staff, clubs, organizations, other administrators, other students, and really thinking about how do we try to create an environment that is supporting a culture of health and well-being in all sorts of different ways, again, to help our students succeed during their time here at MSU and beyond. So when we talk about these terms, health and well-being in college, they're terms that you hear a lot, I'm sure, as you're exploring colleges and exploring what those opportunities are. And that, again, is a good thing that people are talking about. How are we attending to these things? So for us, when we're talking about health and well-being, I do like to be clear about what those terms are. When we're talking about health, there's a typo on this slide. Oh my gosh, sorry about that. I can't not see that now. But the state of complete physical, mental, and social well-being, not merely the absence of disease. Whereas well-being is an optimal and dynamic state that allows people to achieve their full potential. And so we're really not just focused on how do we treat an illness or treat depression that might be coming up and intervening in crisis. Those are important points for us and places we do intervene with students, but we're also really trying to help support their entire well-being in ways that they can thrive and achieve that potential while they're here. So I'm going to dive in for the next part here and talk about more in depth about each of the services that we offer within the Student Wellness Center, and what that looks like for students here. So I want to start with our basic needs support. This is, I would say, something that we're seeing more and more, not only on college campuses, but kind of throughout our society as well, is just the need for additional basic needs support and access to those basic needs services. So on the first floor of the Student Wellness Center, that's where we have our Bounty of the Bridgers food pantry, as well as these other resources. So sometimes students are struggling with or need support in accessing different health insurance plans. They need to know how to navigate that. They might need public resource assistance, and we have a team there that can help them navigate that if that's a need for students. Our Bounty of the Bridgers food pantry is a resource for students that can come in who might be facing food insecurity. In the fall of 2025, we had over 3,600 visits. We have 3 satellite locations across campus, trying to make that really accessible to students. And we distributed over 28,000 pounds of food in the fall. Side note is that we do a pretty significant food drive in the fall called Can the Grizz, where we all of the food raised around the football game between MSU and another college in Montana. Both schools and communities are raising food and money for the food bank, and all of that we raise on campus goes to our food bank, which is a wonderful community event and ways for students to be involved in supporting the programs that we do out of our basic needs area. We also provide a lot of health education programs. So when we're talking about well-being, I think an important part of that is, how are we engaging in prevention work? How are we providing education for our students to be thoughtful about these new opportunities for them to make choices, maybe in areas that they maybe haven't experienced, or are now maybe more independent in those choices. We know in the college student population, sexual health and wellness is really important and a critical age for students, as they're maybe exploring that more, having new experiences that they haven't had before. So we do a lot of education around sexual health, accessible contraception, education around sexual health and taking care of yourself. We've done a lot to increase our promotion of sexually transmitted infection screening opportunities within our health clinic, but we do a lot of that education work out of our health education programs area, and really normalizing that, trying to destigmatize students talking about that, learning how to access care and how to have those conversations. We also do a lot of alcohol and drug education, as I mentioned kind of early on, that access to substances and just being around that on campus is something that we take really seriously in terms of providing that education for students. All incoming students do an overview training about substance use and misuse, and how to make choices and provide education around that. On our campus, we know in our last survey that we did, 68% of our students reported drinking alcohol in the last week. And that seems about on par with what we see nationally. And so we also like to normalize that not everyone does drink alcohol, right? And that's an important part too, in providing support for students who are not engaging in substance use at all. And then we provide seminars for our students around Party Smart, Knowing Your Pour, helping them have the education. So if they're choosing to use substances, they have ways to do that in a way that are reducing their risk, and informing them about what those choices might be. And then lastly, we do a really fun program in the Wellness Center called Wellness Wednesdays. I realize you can't see on that all the different programs we offer there, but really thinking about how students can come into our space and learn about any hot topic related to wellness. This week it was called Sleep Maxing, learning how to manage sleep, knowing that that's critical for students' health, well-being, their cognitive functioning, their ability to focus in school. So all of those are some of our great health education programs within student wellness. When I took over this position as the associate vice president, actually it was I guess as we move to the more integrated model with campus recreation, one of the great things that I learned when partnering more with my colleagues in this area is like they bring the fun. And so it's been really awesome to work more closely with this team and think about the importance of how we're engaging and building community in these fun, active environments as well. And so campus recreation includes all of the fitness facilities within our student wellness center. We get about almost between 1,700 and 2,000 people coming through the gym each day. So it's really heavily used, which is awesome. We have a strong group fitness program. So our group fitness program includes classes for students. And an important part of that is that we encourage students to come in and just try a new program or a new class if they've never done that before. So one of the things that for us in thinking about how we created these programs within the Student Wellness Center is making sure we're reducing any barriers for students to be able to feel like they can come in and try something. So yoga classes, cycling classes. I actually started going, I was like, I have to put my money where my mouth is on this. So I've started going to the strength class over there twice a week and in trying something new in that way and engaging with those opportunities. One of the great things within the Student Wellness Center is the climbing wall, which was more on that first slide, the full climbing wall, but it's a 45-foot wall. Students have the opportunity to use equipment that we have there for them. If they've never climbed before, we have beginning climbing clinics. They do a lot of fun activities in there to get students on the wall and trying something new. Also, student clubs can come in and use that space for their clubs. So lots of different ways students can begin to do that. And for those more advanced climbers, lots of opportunities on that 45-foot wall to hone their skills there. We also have bouldering walls for students who can come in and do that whenever the facility is open. Functional fitness is another big part of the space, and you can see in this lower picture just kind of some of that functional fitness too, with the ramp and all the different opportunities for students who are engaging in training with beautiful views of the mountains while they're doing so. We have a strong aquatics program. The pool is a leisure pool with some basketball hoops, 4 lap lanes, as well as a vortex area. So great for kind of serious swimmers, but also great for programming. So Halloween, we do like a monster splash and we have a big screen and we show a movie in there. At Valentine's Day, they all watched 10 Things I Hate About You, I think was the movie. So lots of ways for students to come in and connect with each other and take advantage of that space. We also have 4 courts in the facility, a track that goes above the courts. And then lastly, on this slide, to just touch on briefly our student employee opportunities for students. Interesting that I think for a lot of people, they think about that transition to college, and rightfully so, thinking about their academics and how they're going to focus on that. But we also know a lot of times when students have a little bit fuller schedule, they actually do better with time management if that works for them. So student employment is a critical part for us within campus recreation. We have anywhere between 100 or 150 student employees. So students who want to be involved in all these different things, we have lots of opportunities there. Of course, I welcome students to come work for us, but even if not us, there are lots of great student employment opportunities on campus. And when we think about health and well-being, oftentimes that can be a great way to kind of support that as well for students. Also within campus recreation is our outdoor recreation program. So Montana State University, we're known for mountains and mines, and we take that seriously with our outdoor recreation program. So we have a rental shop for students who want to come and rent gear if they don't have that available to them. Again, thinking about ways that we're making the environment accessible for students. Not everyone has been in the backcountry. And so we have trips that will take students out into the backcountry and provide that support for them. Lots of clinics that we do to enhance students' skills and knowledge in accessing all the great outdoor activities. The one I saw that we're starting next week is fly tying clinic for students can come learn how to tie their flies for fly fishing. We do avalanche training, we do wilderness first aid training, we do clinics on all sorts of different ways to be safe in the backcountry. We also have a bike and ski shop within the Student Wellness Center, which if you're a person like me who likes to take your equipment somewhere and drop it off and have someone fix it for you, this is not the place for you. If you're a person that we're hoping most of our students are who want to learn how to take care of their equipment and learn those skills, then the bike and ski shop is for you, where we're kind of getting close to that in-between season, but right now it's still ski season. You bring your skis in, we have some of the materials there that you need, and you learn how to take care of them, repair those rock chips as we get into spring skiing, adjust bindings, all of those things we can teach you how to do within our bike and ski shop. And then lastly is trip planning, just supporting students to know like where's a good place to go in the outdoors. If you are new to the area or newly entering the outdoors on your own without the support of family or your support network, that can be intimidating. So have our staff who can help with trip planning and figuring out maybe this is a great place to go at this time of year. Maybe there's been bear activity in one area and you don't want to go there. So lots of support for students through our outdoor recreation program to get them outside. And then lastly, on the campus recreation side is our intramural and competitive club sports programs. Lots of students, when they're making that, if we were in person, I'd be asking for a raise of hands, right? Like how many of the potential students out there are athletes? And my guess is a lot of you are. And that can be a change coming to college in terms of maybe if you've been a varsity athlete, maybe that doesn't continue in college, but you still want to be engaged in your sport or try something new. I have found that both of these programs are great ways for students to build community and to have, again, some of that structure and to have ways to be active in a fun environment. If you like competition, you can find highly competitive areas here. And if you don't like super competitive ways of being on a team, we have those too. So our intramurals program, you can see some of those listed here at different times of the year. We have those. We do both kind of a season for some of those, and there's some level of competition within the intramurals program, whether that's kind of league play or some tournament play. But these are some of the examples of the intramural sports we have available to students, and students can sign up for those and hop on a team and get going whenever those open seasons are. I have to say intramural basketball is one of the most competitive things I have seen in the Student Wellness Center. It gets pretty serious, but it's also like they're having a blast. So it's really fun to see that energy amongst our students. Our competitive club sports program are for those students who might want to have a higher level of intercollegiate competition. So they all compete. And there's some of them have tryouts, some of them don't, but lots of different ways for students to be involved in a more competitive club sport format. So these are some of the competitive club sports that we have, with images of our lacrosse team and our women's rugby team. Our women's lacrosse team, I think, is ranked #1 right now. Our men's hockey team is going to national. So we've won national championships through our clubs program, and lots of great ways for students to get involved in that and to meet peers and also build that community within a team. So I'm going to shift a little bit and talk more about some of the clinical services within the Student Wellness Center. And so our building has a really great new addition we fondly call it the West Tower, and that's where most of our clinical services are. And so again, making it really easy for students to have access to their healthcare and their mental health care within the same facility that all of our campus recreation services are and those basic needs services. Our student health services is staffed by MDs, advanced practice practitioners, we have nurses, medical assistants, the full spectrum of staffing in our clinic. This is a picture of some of our staff last fall at one of our flu clinics. We gave over 1,500 flu vaccines last year, and we did this flu clinic outside, but we also are working more on how do we take healthcare out to the students. So we would do vaccine clinics here in the student union building when students could stop by and get that between classes. So lots of ways that our healthcare team is really present on campus and trying to provide that education and make it easy for students. We had over 7,000 patient visits last fall, so it's a well-utilized service for our students within our student health clinic. So I'm going to talk a bit about each of the different areas within student health. So our medical services is, again, our clinic where we provide healthcare for students. So we provide both same-day urgent care for students as well as kind of ongoing or primary care. So students who maybe I used to give the example where they're not feeling well and they might have a cold, and actually we probably don't need you to come in for that. Probably at first we want students to kind of try to take care of that, but if it's progressing or they're feeling like it's turning into an upper respiratory infection of some sort, we have those same day urgent appointments. We have students who get an injury and they walk in and they need that same day kind of care by a provider, whether that's frequently actually it's some accidents that happen because our student population is so active. And so they're coming in and accessing those same day urgent issues. But primary care, I think, is really a great opportunity for students to establish with a medical provider who can follow them and work with them throughout their time, whether that's sexual health, chronic disease management, wellness checkups, all of the things that maybe you're currently doing with a primary care provider at home. Those same services can be provided here for our students who are accessing those primary care services. Some of our specialty services within student health include psychiatry and medication management. So we have a psychiatrist and a psychiatric nurse practitioner. And we know mental health is one of the most presenting concerns they see in our student health clinic as well. So those psychiatric providers can provide that more specialized care, looking at medications that might be an important part. If a student is entering and they're previously on a medication and they want to continue that and have someone here follow that, we would have them meet with one of our providers and just establish here and determine that then they would be able to transfer that care and provide that care within student health. Our other specialized service is dietitians. So we have a registered dietitian on staff who students can meet with her and get nutrition counseling. That can be for any number of reasons. Sometimes students struggle with what does that look like if you have special dietary needs, what does that look like, and how do you manage that within our dining halls? Maybe it's you're training for something and you want nutrition counseling about how to maximize that training. Maybe it's a new diagnosis or a new food sensitivity or allergy. All of those things certainly dietitians can handle, along with certainly supporting students with body image or eating concerns. And then we have a full service high complexity lab and x-ray right on site. So students, again, just making that pretty easy and accessible for them to come in and get all those services within our clinic. After hours or more specialty care, we refer off campus. And so our providers can certainly help students access some of that outside of the health clinic as well, if that's needed. Our pharmacy is located on the first floor of the Student Wellness Center, which makes it really easy for students to stop by and get their prescriptions filled in between classes. So one of the things I really appreciate about our pharmacists is how dedicated they are to providing that education to students. I do recognize that's part of what pharmacists do anyway, but our pharmacy team really cares about the students and taking that time to have recognizing where they are in terms of their health literacy and learning how to navigate medications. So talking to them about, if you're drinking alcohol on this medicine, here's what might happen, and trying to help students kind of break down any stigma or taboo they might have about talking about the questions they have related to medication, side effects, those sorts of things. So they're a really caring team that helps students navigate that. They also have over-the-counter products available for purchase for students. And so students can easily just kind of swing by and get any kind of over-the-counter things that they might need, whether that's, it's a lot of, I've asked them recently, like, what are your most common over-the-counter things? And they're definitely skincare. So all of those skincare needs can be met there too. But it's a great resource for students to just have right on campus. Students who want to transfer in prescriptions, we make that really easy for them. If they have a prescription or if they want to get it filled from another provider, we can certainly do that within the pharmacy. And then lastly, on our student health side is our dental services team. And so they're located up on the 3rd floor of the Student Wellness Center. And these services have some subsidized costs to them. And I'll talk at the end about eligibility and costs in general. Spoiler alert, it's pretty much free. But the dental services do have some subsidized costs associated with the services that they provide in dental services. I like to joke that they have by far the best views in the Student Wellness Center. The views are spectacular all throughout, but the dental services, it makes you want to just go get your teeth cleaned because you get to sit in this beautiful space and look out at the mountains. So we do cleanings, exams, restorative care. It's a great first stop if a student is maybe needing a referral for a higher level of dental care. We can help provide that too. I did once see a student standing outside the door with some teeth in their hand, like, can you help me? Following a mountain bike accident. So our active students might find themselves in need of that dental care. The other thing I would say on dental services is just that our students have really advocated for the importance of that and recognizing how dental care is critical for whole person healthcare and well-being as well. So, I mean, we've had students who've maybe never had dental care in any regular way prior to coming here. And so we'll meet students where they're at on their health journey in any of these areas and help them build those skills and access the care that they need here on campus. I think that's all I want to say about student health. Next up, we're going to talk just a little bit about mental health and counseling and psychological services. So this is our mental health clinic, located also on the 3rd floor of the Student Wellness Center. When our students were heavily involved in helping us design this facility and identifying what it is they need in the facility and what they want because it's their building, the number second on their list was a climbing wall. That was really important to students. But number 1 on the student list was counselors. We do this counseling and psychological services existed before the Wellness Center, but really recognizing the need for better space for that and making sure that our mental health care was front and center for our students. And that really makes sense when we think about kind of the what we talked about at the beginning with maybe the onset of mental health challenges. Certainly we've seen kind of a more open dialogue across our country too about mental health and mental health challenges and just really working to destigmatize talking about those things. So mental health was the primary thing that our students wanted. This is this year's team within the counseling center. Again, staffed by licensed clinicians. So we have counselors, social workers, psychologists, professional residents, and interns as well, providing a range of services for students. If a student is previously established with a counselor and they want to kind of reconnect with someone here, they can definitely do that. And when students come to campus in the fall, we can sure talk with them about how do you get established with a provider here. They provide services within a short-term model. So typically students who are looking for longer term or kind of maybe weekly therapy sessions throughout their time, that will often be a referral to the community. But most students get what they need by accessing the short-term services at counseling and psychological services, or CAPS for short. This group also provides a lot of our outreach and prevention related to mental health. So we know sleep, we know coping skills, we know time management, stress management, all of those things are really critical. And so our team gets out there and does a lot of outreach and prevention work related to mental health, including suicide prevention, which we'll talk about a little bit more here in a minute. Services at CAPS are confidential, and so that's a little bit different, I think, for people to navigate when they come to college, just knowing that that level of confidentiality now extends to the student. So even though family members might be interested or wanting to support the student's healthcare needs stay private. And if a student wants a family member or other person involved, they can sign a release for that to happen. But sometimes for parents, guardians, family members, that can be a little bit of a shift, just knowing that confidentiality extends to the student at this point when they start services here on campus. CAPS also provides, in addition to the individual counseling services, a lot of great group counseling offerings. So knowing that sometimes students want to connect with other students who might be going through something similar. And so those options are available for students to access group counseling, whether that be kind of a general therapy group, just talking about transition or anxiety, depression, relationships. All of that can be a part of those general groups. They also offer sometimes more specialized groups related to one called Nourish, related to body image and eating concerns. They do some mindfulness groups that are really focused on helping students manage usually anxiety, but using a mindfulness skill to kind of treat some of those issues in a clinical setting. They've done grief groups in the past. So they try to tailor the offerings for their group program depending on what kind of needs we're seeing from students. I'd like to kind of talk just generally about like what is the state of mental health within at MSU and also with our college students, just knowing that that really tends to be, you hear a lot about that in the media. I have certainly seen a change in that in my time here at MSU. I can remember when I started as an intern, and I was super excited to do some tabling events and go out and talk to students and be ready to chat with them about their mental health. And sometimes they'd get close to the table and then walk away when they saw that I was with the counseling center. And I'm like, I'm not that scary. But there's just quite a bit of stigma around that, and not to minimize that might still be there for some students, and we do a lot to try to decrease that stigma. But we know that's also changed quite a bit, where students are more comfortable talking about their mental health needs. We see that in them choosing mental health to be their top priority in the building. We see our students talking about mental health in lots of different spaces on campus. And part of that is because we know that a lot of students are dealing with mental health issues. So this study just gives you a snapshot of sort of what that looks like on our campus back in 2023. So you can see kind of generally that about 33% of our student body, not a clinical sample, but the general student body, 33% of that sample had moderate to severe anxiety, and about 39% had moderate to severe depression, right on par with what we see in the national numbers, but knowing that quite a few students are dealing with those top two presenting issues. And then we also know that, of course, mental health can have an impact on a student's academics. So the way we phrase this question on the Healthy Mind study is, how many days have you felt over the past 4 weeks, have you felt your emotional or mental difficulties have hurt your academic performance? And that was 83% of our students. So when we think about the importance of embedding these services throughout our whole entire campus, of course, that's important, where we know it's impacting students' academics. A counseling center cannot provide direct individual counseling to 83% of our students, and nor do 83% of the students necessarily need that. But what this tells us is that it actually is really important that we're talking about these things in the classroom, in clubs, in the residence halls, really creating a culture where people know how to talk about it and identify someone who might be struggling to make sure that they can get the help that they need. So CAPS typically provides services to about 11% of the student body for clinical services. And as I said, the top concerns tend to be anxiety, stress, depression, relationship issues, and motivation. And we also recognize that we have sometimes students who are struggling more with crisis. So of the clinical population that goes to CAPS, about 40% of those have seriously considered suicide. And the reason we talk about that really openly, even in this setting, is to just know that there are resources available. Suicide is the third leading cause of death for college students. And Montana, we know that that continues to be, unfortunately, a public health issue that we're dealing with. What I would say is that our campus takes that really seriously. And so suicide prevention is something that faculty and staff, we do trainings for them. We do trainings for all residents, life staff. All athletes get suicide prevention training, and really creating a culture of care where students, faculty, staff know how to identify someone who might be struggling and make sure they know how to get them to the help that they need. And so again, those numbers aren't unique to MSU. I would say they're pretty typical of what we're seeing across the country too. But knowing that those crisis intervention services are available here on campus for our students, and also to support faculty and staff who might have questions about how do they support a student who is struggling, the team at CAPS can certainly provide that support to them. The additional services I would say through CAPS are care management and referral. So if someone's wanting a longer term counselor, we have vetted a database where we kind of include providers who want to work with college students who we can provide referrals to. We have drop-in consultations across campus called Let's Talk, where a student can just pop into a different building and spend 10 minutes with a counselor just to talk about something that might be going on with them in that moment. So lots of ways for students to interact with the CAPS team. And then just to know that not the majority, almost all of the students who seek services at CAPS would say they'd refer a friend, which we know, of course, that peer endorsement is critical. And so that they take that really seriously in CAPS to make sure that there's that they're providing the services that the students need, and that they're getting better and they get the support that they need in that space. So I briefly talked about that after hours support on the medical side. And then for counseling, we do partner with some local providers through the 988 line here in Bozeman. And so the CAPS team is on call and can provide some of that additional support outside of 988 if that's needed. So know that that's something that we've thought about, and we have ways to support students who might need after hours support as well. So lastly is just to talk about eligibility and access to all of the fabulous things I just told you about within wellness, but all students are welcome within the building. We have a beautiful common space that students can come in and study. It was packed as I walked over here tonight. I can see the climbing wall from here, and students are in there engaging in the space, and all students are welcome in there. Students who pay the fees at 7 or more credits have access to going and using the gym, the health clinic, and the counseling services, but students taking less than 7 credits can opt into that fee. An important point about that is that when it's like it gets you access, that means there's no charge for your doctor visit. There's no charge for your counseling visits. We're not billing insurance for those things. It's truly you pay at the 7 credits, you're paying that health fee, and then you have access. You're paying both the recreation and the health fee, and you have access to all of the services within the wellness center. Yeah. And then there are a few things that are more low cost services and programs. So any minor medical procedures, the actual immunizations, some of those specialty services that we offer, those have some low cost fees adjacent to them, but they're truly low cost and just help us help fund the programs or the staffing to do that. So club sports and intramurals will have some additional fees for those. The pharmacy, obviously, students are paying for the prescriptions that they're getting. The pharmacy is the one place then that will bill insurance for students, their pharmacy insurance through that. And then, as I mentioned, the dental clinic as well has those low-cost services and programs. But generally, students taking 7 or more credits have access to all of these things. And I would say it's just important that they take advantage of that. We want them to be in the building and trying all of the new things and get involved and meet new people and have new experiences when they're here. Our feedback from students has been really overwhelmingly positive about not only the facility, again, here's another great picture of that, but really of all their opportunities to get involved in there. So I'm proud of not only the facility, but really proud of the work that we're doing and how our students are really engaging in this model and participating in all of the great things that we have in the Student Wellness Center. So with that, I think I will end there and stop sharing if I can remember how to do that, and open it up for questions if there are some.
Awesome. Thank you so much, Betsy, for taking up the last couple 15 minutes here and sharing what those different opportunities are for students here at Montana State. I do have a couple of questions that have been shared with our students as they were registering for this event. And I want to go ahead and throw one of these out for you just because it seemed like it was one of the ones that was the most asked. So one of them, especially in the chat, it was, is there mental health or is the mental health counseling that is run through MSU, is that something that's included with tuition? Is there additional costs that are associated with it? What does that process kind of look like for students if they're interested in utilizing it?
Yeah. So students who are taking 7 or more credits, then they have access to those counseling services. If they're taking less than 7, they can opt in to pay the fee. I will say that all students, if you've paid the fee or not, can always come in and do an initial intake appointment. So that we really feel strongly about, just having some point of access to sit down and meet with one of our therapists, because they all have expertise in college mental health. That's what they do every day. And so they really want to take the time to understand what's going on with that individual student. And then from there, help them determine if they want to continue with ongoing counseling services here at our clinic, or if they're needing a referral off campus. But again, let's say by far the majority of students kind of get what they need seeking those services right here from the counseling and psychological services and that short-term model. So once they have an intake appointment, they get assigned to work with a counselor who's a good match with what their needs are, and then they engage in either weekly or bi-weekly sessions with that therapist, kind of addressing whatever that mental health issue is. And then sometimes that might transition to group work. Sometimes students will say they kind of got what they need. Lots of different ways that can play out, because we really want to tailor that and make it individual to the student and what their mental health needs are, but no charge for any of those sessions.
Perfect. That's amazing. One other question that's kind of down the same alley, ish to a certain extent. So if a student has prescriptions that they are currently taking at this point in time before they're at Montana State, can you kind of go over what that process looks like on how they bring those prescriptions over from out of state or from another pharmacy, anything like that?
Yeah, great question. So when students are here for, not move the table, sorry. When students are here in the fall and they're starting classes, like that's a great time to initiate that process. So we always recommend that students come with, if they're on a regular medication, like be sure you have enough to get you started here. And then they can be transferred directly to our pharmacy. So that can be pharmacy to pharmacy. And all of that information is on the pharmacy website. Or if it's a new prescription, then that new provider can directly kind of send that prescription over to the pharmacy. Some students want to establish with a provider within Student Health Services who then would take over making that prescription directly to the pharmacy here. Students don't have to use that pharmacy. Like they could see a provider in Student Health. If they wanted their prescription sent off campus, they could. That very rarely happens. But you could. So it's not like you have to do it on campus. But again, the pharmacists just make that really easy, whether you're in state or out of state, and then they'll bill that through the student's pharmacy insurance. And then whatever cost there might be, the student can pay, or it can go on their student account. If they have frequently, there will be a copay or something like that.
Perfect. Another really good question, and I know I get this question asked quite often, especially when I'm meeting with students regarding the health insurance that MSU has. Um, is a student required to utilize MSU's health insurance, or are they able to stay on their parent or guardian's insurance?
Right. Great question. I did not cover insurance, so I'm glad you brought that up. The Montana University system actually has a requirement that all students taking 6 or more credits have insurance. That's totally separate from what I've been talking about with the fees to access the facility. So there's an insurance requirement from the Montana University system, 6 or more credits, you have to have insurance. Your students are welcome to stay on their parents' insurance or whatever way they want to meet that requirement is totally up to them. The Montana University system does offer a plan for students who maybe for whatever reason want a different plan or have a need for that or don't have access to another insurance. I would always recommend for someone out of state to take a look at what their plan would cover within the Bozeman area, because oftentimes it's just so unique. We don't know like what that would look like plan to plan. So students can certainly choose the MUS sponsored insurance plan, but they don't have to. And students who might have out of state Medicaid, we know that can sometimes be a challenge for sure. So lots of ways that our insurance navigation crew within basic needs can have those conversations with students to talk about their individual situations, but no, they are not required to purchase the MUS insurance.
Perfect. Awesome. Um, and then I thought this one was kind of interesting. I know that we covered it like pretty well in depth about some of those specific activities that are available to support students. But one of the questions that we had that is related to that is what mental health counseling or mental health supports are there available for students that are like specific activities to help support those students? So they kind of talked about like, is there like dance or yoga, Pilates? Is there something like that that maybe has a little bit more of a filter towards helping support that mental health side?
My gosh, it's like such a great question because that's where we're trying to go. We
Perfect.
started a group called Movement is Medicine. So let me back up. Lots of ways that the mental health clinicians would help the student consider what those activities might be available to them and could be helpful for supporting their mental health and well-being. So they wouldn't have to do it in like a group setting, but the counselor might say, hey, have you checked out the yoga classes over at Campus Recreation? I think that would be really awesome for you. Another avenue would be through the mindfulness groups within counseling. Those have some movement component to them sometimes. So that's another way movement might be incorporated into treatment. And then the third way I would say is a new group that we've tried to launch called Movement is Medicine, where it really is specifically targeted for students and can be a direct referral from either a medical provider or one of the counselors to this group that's really intended for students to start to build movement into their routine, both strength and movement practices to support kind of the treatment of depression and anxiety in particular. So that's one example of a program with the campus rec team on the fitness side, medical, counseling, how we're all kind of coming together to bring all those pieces to support students. So I just love that someone asked that question because that's where it's at. That's the next step in all this.
Awesome. That's wonderful to hear. I know a lot of people find help in their mental health and taking care of that through those different opportunities. So that is wonderful to hear that side. Um, well, I think with about 2 minutes left, I just want to go ahead and share a couple of pieces of information with all of you that are still on with us. Again, thank you so much to Betsy for joining us this evening and sharing what that wellness opportunity looks like for you here at Montana State throughout your years spent here. When you are going through the evening, something that you should know if you're like, oh, Betsy talked about this. I just can't remember. What does MSU have to offer according to this? Or if you have a friend that's like, what does wellness look like at MSU? Anytime later on, any of those of you that are registered for the event, you will be getting a follow-up email probably in a day or two with our admissions team that has the recording of this webinar. So if you ever need to reference anything on here, you'll have the opportunity to check that out. And if for some reason you can't find it, you could always find our Montana State Office of Admissions YouTube page, and we will have it hosted on there. And that's how we share it out to you all. So for those of you that joined us this evening, thank you so much for letting us take an hour of your time and talk about student wellness and what the options are here at Montana State. And with that, we're going to give you 1 minute of your hour back. And with that, thanks everyone, and I hope you all have a great night.
Thank you.